Hello, interpreters, and welcome to this training. Today, we'll be covering one of the most important trainings that you will receive as a freelance medical interpreter protocol, ethics, and best practices. This training is designed to prepare you to provide safe, ethical, accurate, and professional interpreting services in every healthcare encounter. Remember, every interpretation can affect a patient's health, treatment, and even their life. Medical interpreters are not simply bilingual individuals. They are trained professionals responsible for ensuring complete communication between healthcare providers and patients who have limited English proficiency. By the end of this training, you will understand your professional role, interpreter ethics, medical protocols, best practices, remote interpreting expectations, professional conduct, and patient safety responsibilities. So, now, what is medical interpreting? Medical interpreting is much more than translating words. It is the accurate transmission of communication between patients and healthcare providers without changing, adding, or omitting information. When patients cannot communicate with doctors because of language barriers, professional interpreters become their bridge. Without qualified interpreters, serious problems can happen. Examples: wrong diagnosis, medication mistakes, incorrect treatments, patients signing consent forms without understanding, delayed medical care. So every word matters. Sometimes one incorrectly interpreted medication dosage can seriously harm a patient. That is why medical interpreting is considered part of patient safety. Always remember, you are protecting communication. Communication protects patients. We will learn how to interpret accurately, maintain confidentiality, remain impartial, respect professional boundaries, understand cultural differences, work professionally in OPI and VRI environments, improve quality assurance scores. So now, let's discuss the foundation of our profession, ethics. Professional ethics guide every decision that you make during an interpretation. There are four core ethical principles. The first one is accuracy. Accuracy means interpreting everything exactly as spoken. Do not summarize. Do not simplify. Do not explain. Do not improve someone's wording. Interpret everything. If the patient says, "I've had pain for 3 weeks," you must interpret exactly that. You cannot say, "My pain has been bothering me." Those are different meanings. So every detail matters. So now the second one is confidentiality. Everything you hear during an interpretation is confidential. Information is protected by HIPAA. Never discuss patient information with family, friends, other interpreters, social media. Even if the patient's name isn't mentioned, confidentiality continues after the call ends. Violation or violating HIPAA can result in termination, legal consequences, loss of certification, loss of trust. So, as you can see, confidential is really important. Now, impartiality. Impartiality. Medical interpreters must remain neutral. Never take sides. Never give your personal opinion. Never answer questions for the patient. Never answer questions for the provider. If the patient asks, "What do you think I should do?" do not answer. Interpret the question exactly as it is. Your opinion does not belong in the medical encounter. Now, professional boundaries. Your role is communication. Do not advocacy, not counseling, not medical advice, not social work, not making decision. If the provider asks, "What do you think she means?" Interpret exactly what was said. If clarification is needed, facilitate communication between the provider and patient rather than providing your own interpretation of intent. And now, I want to talk to you about the modes of interpreting. There are three primary modes of interpreting. The first one is consecutive. The speaker pauses. The interpreter renders the message. That is the most common mode in interpreting, in medical interpreting. So it is really important use note taking. Listen completely and interpret completely. That is consecutive interpreting. The second mode is simultaneous. That is used mainly in conferences, surgeries, or specialized settings. It requires advanced interpreting skills. Most freelance interpreters will primarily use consecutive interpreting. And the third one is side translation. This is reading medical documents aloud in another language. Examples include consent forms, discharge instructions, medication labels. You should only perform side translation when requested and when you understand the document completely. That is really important. So now remote interpreting, that is also really important. Most of your assignments will be either OPI or VRI, which is over the phone interpreting or video remote interpreting. So professional setup is critical. Before you start taking calls, you have to test your headset. You have to test your microphone. You have to check your internet connection. And you have to log in early. Choose a quiet location. Use a professional background, solid background, and or a blue or a blue background, solid blue background, or if you have a virtual background. For video remote interpreting, is really important to wear professional clothing. Maintain eye contact with the camera. Avoid eating, drinking, or multitasking when you are on a VRI. Speak clearly. Never interpret while driving or from a public place. Your workplace should reflect the same professionalism expected in a hospital, and that is remote interpreting. You see? Now, let's talk about medical terminology. Medical terminology. Medical interpreters must continuously improve their skills on terminology. You are expected to understand terminology related to anatomy, body systems, medications, diagnostic tests, specialties, procedures. If you don't know a medical term, do not guess. Ask for repetition. Ask the speaker to spell it if needed. Request clarification. Guessing is never acceptable at all. Now let's talk about cultural competency. So every patient comes from a different cultural background. So cultural affects communication, decision making, family involvement, health beliefs, pain expressions, religious practices. So your responsibility is not to judge. Your responsibility is to interpret accurately while respecting cultural differences. So remain neutral. Never stereotype patients. Never assume. Treat every individual with dignity and respect. That is really important. So, some challenges, or challenging situations that you can experience. Some conversations are so emotionally difficult. So, for example, mental health, cancer diagnosis, end of life care, child abuse, domestic violence, emergency trauma. So during these situations, you have to stay calm. You have to control your emotions. Interpret everything. Never cry during the encounter. Never interrupt because something is emotionally difficult. After a difficult session, use healthy coping skills or coping strategies to calm down. So professional interpreters care for themselves so they can continue caring for others. That is important. Professional development. Let's talk about professional development now. So it is so important. Learning never stops. So you have to keep on learning. Excellent interpreters continuously improve. So continue studying the medical terminology, ethics, HIPAA, telehealth, cultural competency, and certification through organizations such as CGSI. Demonstrate commitment to professionalism and lifelong learning. That is something that you can also take into consideration. So that is also cultural competency. So best practices. Let's talk about best practices. So let's review the habits of outstanding interpreters. They arrive early. They stay prepared. They interpret everything. Remain impartial. Protect confidentiality. So ask for clarification instead of guessing. Maintain professionalism. Respect everyone. Accept coaching. That is important. Accept feedback. Accept coaching to improve. And also continue learning. These habits improve quality assurance scores and build trust with clients. I want to share some resources and references. Continue your education using professional resources such as CCHI, NCIHC, Standards of Practice, IMIA, Code of Ethics, Medline Plus Medical Terminology. Professional growth is continuous. Every assignment is another opportunity to improve. So I want to say thank you. Thank you for joining this training, and we learned the following. We have learned that being a medical interpreter means such more than speaking two languages. It means protecting communication. It means protecting communication. It means protecting confidentiality. It means protecting ethics, protecting patient safety. So every call you receive represents someone's health, someone's family, and someone's trust. As medical interpreters, we have the privilege and the responsibility to ensure every voice is heard accurately and respectfully. Thank you for your professionalism, for your commitment to excellence, and your dedication to saving patients and healthcare providers with integrity. Congratulations to completing the medical interpreter protocol ethics and best practices training. Please, thank you very much, and you have a wonderful day.